Dr. L, take one. What would the title of your autobiography be? VU. So I'm Mark Leondires. I'm the medical director of Reproductive Medicine Associates of Connecticut. Also the founder of the practice. I grew up outside the Boston area. In fact, when I grew up, my name was Mark. I had a very horrible Boston accent. As a child, you know, I was always fascinated by science. I was the kid with the bug collection. I was the kid with the tadpoles. I was the kid who wanted to be a veterinarian, and I really always really liked science and sought to understand more how the world worked. This practice is really an extension of myself and my personality, and I'm very proud to have it at the state that it's in now. So an embryo transfer is probably the most stressful thing that any of the doctors here do. So we're basically placing an embryo that's 100 times smaller than a printed period into the uterus of an intended parent or gestational carrier. And it is basically this magical time where you're placing an embryo that was created in the laboratory, that you can see that is alive, that is sparkling and growing into the uterine cavity. And you can visualize this on ultrasound, and it's actually really quite remarkable because the embryologists load the embryo with a little air bubble, and air on ultrasound shows up as bright white. So literally when you deliver the embryo into the uterine cavity, there's a little flash of white that occurs. So it's a very kind of special moment. So many patients come in overwhelmed with information from the internet. Some of them have been through so much angst and hurt. They're very scared. We've built this practice to basically envelop them in the latest science and technology with a focus towards caring for them, the people, understanding that infertility is a major life stress. Wanting to have a baby is something that is hardwired for most humans. They should leave here with hope that if there is a possibility for them to be successful, that they're going to achieve their dreams with the help of the team that we put in place for them.